Diabetes affects millions of people. In fact, in the United States, according to the latest statistics, about 40.1 million people have diabetes or have been diagnosed with diabetes. That's roughly 12% of our population. But many of us don't know we even have it sometimes, or exactly what is it and what does it mean to have diabetes. Today, we're going to break that down. We're going to go over what diabetes is, the different types of diabetes, what are the different treatments for diabetes, including those ever famous GLP-1 medications that everybody is talking about, as well as answer your questions here on Ask the Doc. No appointment needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related question and our experts will answer them. My name is Dr. Kamaljit Kaur and I am a primary care physician here in beautiful South Florida. Let's get right to our questions because we have so many to get to and such great information to share with you today. The first one comes to us from Larkin and he reaches out through allhealthtv.com. Larkin asks, "Hey, Dr. K, I'm a little embarrassed to ask, but what is diabetes exactly? I was just diagnosed as being pre-diabetic, but I don't really know what being diabetic means." Hi, Larkin. Thank you for sending this question in, especially because it sounds like it may be a little embarrassing for you to do so. But I want to reassure you, nothing that has to do with your health should ever be a source of shame or embarrassment, especially when you're asking a healthcare professional for their advice or their outlook into what you're experiencing, because it's your health, it's important, you got to know. So thank you for reaching out. Let's get into it. We hear a lot about diabetes. As I mentioned, a lot of the population has diabetes, whether it's our doctors talking to us about diabetes and how to prevent it or treat it, or TV ads for all those diabetes medications that we're seeing. It seems like the word is everywhere. But what exactly is this condition and what's going on in our bodies when we have diabetes? Let's start from the beginning. Essentially, diabetes is a state or a condition in which very high levels of sugar, glucose, are allowed to run nilly-willy in the bloodstream because insulin, which is the main regulator of glucose in our body, is not able to do its job. It's not able to take that glucose and turn it into good energy for the rest of our body to use and to be at our best in health. In simpler terms, when this happens, that excess glucose that's running around our bloodstream and in the other parts of our bodies, whether it's our eyes, our kidneys, our heart, our nerves, our liver, it affects the body in very negative ways. It can be very inflammatory and cause a cascade of different changes in the body that lead to a lot of health effects and health risks and even other diseases. So, diabetes is basically the process of sugars running too high for too long and causing damage. Why that happens? Because the insulin that's supposed to be regulating it isn't working. Why isn't insulin working? So, insulin, which is produced by your pancreas, is a hormone and it regulates glucose by taking it from the bloodstream and allowing it to go into cells like the liver and the muscle so it could be used for energy there. Insulin doesn't work in some individuals either because over time things have happened, and we'll go over those things that cause our insulin receptors and insulin in the body to just not work as well or to be deficient. Then there's an autoimmune process that some individuals have. This is more commonly known as type 1 diabetes, and that is you're not producing enough insulin. And because you're not producing insulin, you don't have what's needed to regulate all that glucose that's running around. Now, when it comes to diabetes and prediabetes, the main way that we test or screen for this is through a blood test known as hemoglobin A1C. There are different methods of screening and testing for diabetes and states of excess glucose in the body, but the A1C test is probably the simplest and most commonly used. Now, The A1C test is a test that comes back to us as a percentage. And this is reporting to us what have your sugars been doing over the last 3 months in your body. When you go get your blood work done, you might have what's called a glucose test, or sometimes you might have a finger prick. And the point of that is to check what are your glucose levels in your body right now? What are we doing at this very moment? How high or low are they? What range are they in? Whereas the hemoglobin A1C test is more of a marker and it gives a better picture of what your blood glucose sugars were like over the last 2 to 3 months, usually a 3 month period. So it's a better gauge because some days your glucose is high, some days it's low. So we don't like to take just one or two of those readings to make the diagnosis. The A1C gives us a better and more long-term picture to really know what's going on. When you get that A1C test done, it's going to come back, like I said, as a percentage. If it is 5.7% or higher, that's known as pre-diabetes. 5.6% and lower is considered normal. You're getting closer to the diabetic range when you get to 6.5%. Anything over 6.5% is considered diabetes. And let me specify diabetes mellitus. Now, just the A1C on its own doesn't tell you if this is type 1 or type 2. It just tells you sugars have been high, this is where we're at, and this is what we can most likely diagnose with it. It's likely that your hemoglobin A1C number has returned somewhere in the 5.7 to 6.4 range, and that's why your doctor has diagnosed it as pre-diabetes. When you are pre-diabetic, you're not diabetic per se, but you're very close to it. You have a very high risk of progressing to overt diabetes and then all the health complications that come with it. Now, while this may be scary, just because you have prediabetes or you've been diagnosed with prediabetes doesn't necessarily mean that you're going to for sure have diabetes and you're going to have that for the rest of your life. You're going to be on medications and insulin and all that stuff that I know is very much talked about and can be very scary, but you can still prevent it. And there's a lot of ways that you can do this. It just means that you're going to need to focus really diligently on lifestyle factors to help. There are certain instances in which your doctor, even when you're pre-diabetic, might recommend that you take certain medications if you are someone who is at high risk. Like if you have a really strong family history, if you have other health conditions, especially heart conditions, then that might up the ante on what you need to do to prevent actual diabetes from developing. Now, going back to those lifestyle factors that I was talking about, because what's the best treatment? Prevention, right? So we want to prevent you from progressing into actual diabetes. We want to improve your insulin function. We want your body to be working optimal or as best as it can with those internal mechanisms. And one of the best ways to do that is by eating a healthy, nutritious, whole food diet. And that is everybody's talking about it nowadays. Food is medicine, and it absolutely is, because there's a variety of good healthy foods that can actually change even sometimes the way your genetics work and what happens inside your body, and for good obviously, but on the opposite side, bad foods can make bad things happen inside the body as well. And just like a nutritious diet is very important, so is regular exercise. Regular exercise is important for so many reasons, and we'll get into some of those later on in the program. But it's very important to note that you got to move your body. You can't sit still. Being sedentary is really harming our health, especially because so many of us are sedentary nowadays. The other thing you want to manage are your stress levels. There has been a long standing theory, slash understanding that having a lot of stress chronically negatively impacts your health. It definitely increases the amount of inflammation in your body. And then that inflammatory state definitely contributes to the development of a lot of diseases, heart disease, definitely diabetes, and even certain cancers. So you want to make sure that you're managing your stress levels as much as possible. You want to make sure that you're getting enough sleep. You want to make sure that your systems are having the adequate time at night to restore and re-energize themselves so they can fight the battles that they need to fight the next day. And then most importantly, or maybe just right there with a nutritious diet, is avoiding all those negative things that we sometimes consume. Alcohol, you want to limit your alcohol intake. You want to avoid all drugs, any kind of illicit drugs. You want to avoid smoking, whether that's cigarettes, nicotine, vaping, very harmful for your body for so many reasons, but you want to avoid that. And then there's one thing that people don't generally think about when we talk about avoiding risky substances. You know, everybody thinks about alcohol and everybody thinks about drugs, but what about ultra processed foods? Things like chips or sometimes some deli meats with all those nitrates and all the processing. Those are very, very harmful to our body in so many ways. So we want to make sure that we're cognizant of that and limiting our intake of ultra processed foods as well. I encourage you to talk more to your doctor about where exactly you are in your pre-diabetes prevention journey and what you can do best to prevent it from getting into actual diabetes. Remember, everything that we want to focus on is always going to be for your best health. And I hope that your health gets back on track. All right, let's get to our next question. This one comes to us from Leilani, and she's reached out to us through YouTube asking, hello, Dr. Kaur. Is type 2 diabetes caused by eating too much sugar? All right, this is a really good question because it is a very common misconception that I see all the time in my patients. And honestly, it's not completely wrong. That's one of the things that we've seen, especially in the media or when you see commercials. People are eating a lot of candy or sugar or sodas, and that's what's kind of connected, or that's usually what's shown in relationship to becoming diabetic, but it is so much more involved than that. The other thing that I want to point out is a lot of times what I see in my patients is things like, or they'll make comments like, I was diagnosed with diabetes. I guess it's because I was eating too much sugar, or I wasn't exercising enough, or I wasn't. And unfortunately, I feel like a lot of patients have a little bit of guilt when it comes to that. Like, you brought this on yourself. And I want to emphasize that that's definitely not the case. That's not what we want our patients and our viewers to feel like, because your health, we know it's important to you. And sometimes, sometimes we might indulge. Sometimes people have their vices. We all have them. And if that leads to a detrimental process in the body, then I want you to know that it is your physician's main goal to help you get back to a healthy place. So you should never be embarrassed or feel guilty or feel ashamed to come to us and really say, hey, what's my plan for getting back into a healthier place? And eating too much sugar, while it's very easy to do, it's very hard to stop doing. So we want to be there to support you. All right, let me get back to answering your question here. Now, talking about what causes actual diabetes, and especially diabetes type 2, there's a lot of factors. Just as earlier I talked about the factors that help prevent it, not doing those things helps development of diabetes as well. That's also why somebody who might have a genetic predisposition, say your mom, dad, sister, brother, cousins, everybody in your family has diabetes, but you don't, there's more to the story then. It's not just genetics, right? So, what are those other things that help? Well, we talked about it. Eating healthy, nutritious foods and exercising regularly, that very, very much matters. And a combination of all these factors, like I said, either leads to the development or the prevention of insulin resistance, and then ultimately to diabetes type 2. So, if you're somebody who eats a lot of junk food, that leads to the accumulation of fat, especially around the abdomen, which is actually one of the most, if not the most detrimental type of fat to have in the body because it's very inflammatory. And when all that inflammation is going on in the body, it interrupts insulin's ability to process that glucose appropriately. So, what happens? Like I said earlier, the glucose just runs around willy nilly in the bloodstream and it goes wherever it wants because the insulin isn't there to guard it and say, hey, no, this is the right place for you to be, not over there swimming in the nerves or swimming in the eyes or swimming in the heart. So when insulin is not able to do that, that's when you get that insulin resistance syndrome, and then that develops into diabetes and things start to go downhill from there. But exercise, just like exercising helps to metabolize glucose and insulin, or helps insulin metabolize glucose, not exercising and not using your muscles leads to a very inadequate metabolism of glucose. Now, what happens normally is, let's talk about muscles specifically. Insulin helps muscles uptake that glucose from the bloodstream so they can turn it into energy, and it can go to the brain, it can go to all the right parts of the body that need energy to perform at their best. But when you're not exercising, the muscles really aren't uptaking that glucose like they should be. They're really not pairing up with the insulin and saying, hey, let's, get in the right direction here. And again, that glucose just tends to sit out in the bloodstream and do, whatever harmful effects it's going to do. So you want to make sure that you're cognizant that you're moving and you're not sedentary. Things like sleeping not adequately, so getting less than 7 hours of sleep a day on a regular basis, being chronically stressed. These are also states that are, or these are also factors that are going to promote inflammatory states in the body, and then it's going to mess up that insulin and glucose metabolism. So, as you can see, the development of diabetes is multifactorial. It's quite complex. It's not always just eating too much sugar, even though that's something that we should probably work on as well. But there's so much more to the story. I do encourage you to talk to your doctor about exactly your lifestyle factors and your family history. What are you at risk for? And maybe come up with a plan of how it can help to prevent you from getting to that other side called diabetes that we don't want to get to. All right, let's get to this next question. And this comes to us from Curtis. And Curtis reached out to us through YouTube asking, Dr. Kaur, my doctor told me I'm probably going to have to start using insulin. Please tell me what exactly insulin is and what purpose it serves. I hate shots. So, is there something I can do to avoid using insulin? Thank you for reaching out, Curtis. And this is a wonderful question because there is a huge stigma when it comes to diabetes. Majority of the time, when I am diagnosing a patient with diabetes, one of the first questions they ask me is, am I going to have to take shots? Am I going to have to take insulin? Because that's traditionally what we associate being diabetic with. And a lot of times, unfortunately, that is true. But at the same time, there may be instances when you don't absolutely need insulin. Now, as earlier I mentioned, type 1 diabetes, or when you have autoimmune diabetes where your pancreas just isn't producing insulin at all. In those cases, unfortunately, you are going to have to supplement with exogenous insulin, and you're going to have to use the injections to do so. Now, there is an inhaled type of insulin, but for the patients that choose to incorporate inhaled insulin into their regimen, most of the time they still need the injectable version as well to really get the adequate amount that they need to stay healthy. So that's for type 1 diabetes. If you are type 2 diabetic, there's a couple different ways to look at this. If you're type 2 diabetic and your hemoglobin A1C or your degree of diabetes is mild, then insulin may not even be something that's needed for you. Or sometimes, if you're on the borderline of moderate and severe diabetes, and your doctor can tell you exactly where that is for you and what that looks like, then there might be a shared decision making saying, hey, let me try 3 to 6 months of diet, exercise, sleep, stress reduction, really being very, very diligent with my lifestyle and being healthy. And let me see if I can improve my insulin sensitivity and my glucose metabolism. Because if you can, then maybe we don't need the insulin and we can just help treat the diabetes with oral medications, which is always the better goal, of course. We always want our patients on the least amount of medication of any kind that's needed. Now we're talking a lot about insulin and whether we need it or not and how, it works in the body, but what exactly is insulin? So insulin is a polypeptide hormone and it, like I said, it's made by the pancreas and it helps control the amount of glucose that's running around in your blood because as I mentioned, glucose just running around with nothing to do, it can be very harmful to your body. Now, insulin is kind of like a key and as I mentioned with the muscles earlier, so say you have a muscle and you have glucose running around in the bloodstream. Insulin's job is to unlock receptors or certain doors in the muscle so that glucose can come in and the muscle can do what it needs to do with that glucose. But when insulin, like I said, is inadequate or the receptors aren't working well for whatever reason, or if your body's not even making insulin at all, then that process is unfortunately not going to be happening and the glucose can't be utilized for energy as it should be. Now, if diabetes is one of your diagnoses, the first thing you want to ask your physician is how severe or not is it? And what is my best treatment plan considering my lifestyle? If you're somebody who travels a lot, maybe if you don't need to be on insulin, you shouldn't be on insulin because you now have to travel with medications, of course, but now you're going to have to travel with syringes and injections and vials and all this other stuff. So you always want to ask your doctor, what is the best treatment for what I have? And how does that fit into my lifestyle? Because that's very important as well. In the old days, we used to just tell people, well, this is what you have to do, and that's all it's going to be. But it's very important to collaborate with patients because that's going to bring out the best outcomes. You're going to be compliant. You're going to actually want to treat the disease properly and be able to do so, which is going to be so important. All right, I hope that helped answer your question. And I know our viewers have a lot of them, so keep sending them in. And in case you forgot how to do so, here's how you can send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. We have a very interesting question that was just sent in to us from Patrick. And Patrick is asking, two of my friends died from cardiac arrest. I'm chubby. Should I have my doctor do an EKG? Patrick, I am so sorry to hear of your loss. It's very disheartening anytime anybody passes away, but especially from a health condition, and especially one that may have been prevented. And I think that's what you're hinting at here is how can you prevent something like that happening to you? And I very much appreciate you being proactive with your health. When it comes to heart health, where do we start? How do we prevent it? How do we make sure that we're on top of it? And you're right to ask about the EKG because the EKG, the electrocardiogram, is a very simple, painless, quick test that can be done in majority of primary care physicians' offices, and it gives us a good amount of information. But I don't want to misrepresent it because EKGs don't give us the whole picture. It basically is a tracing of the electrical rhythm of your heart. And when we do the EKG, it tells us what your heart is doing right at that very moment. Just like if we were to prick your blood and test it for glucose, we're going to know what the glucose is doing right now, but we don't know what it was doing yesterday or what it's doing next week, etc. Same thing with the EKG. It's a great tool for us to see what's going on right now. And if there have been any heart defects or heart disease that's caused permanent damage in the heart, then that will also show up on the EKG majority of the time. So it's a great initial screening tool, but it's not the tell-all that a lot of people unfortunately think that it is. It is still a great place to start though. So please, yes, ask your doctor, talk to your doctor about it. Now, I want to highlight the other part of your question, the statement you made saying that you are chubby. And this is a word that I've used for myself. A lot of my friends use it. It's kind of just, it is what it is, right? But it means different things to different people. And I want to emphasize on the fact that while you may be carrying extra weight, the first question that you want to know about that is this healthy? Is this weight that is affecting me in a negative way, is affecting my health in a negative way? Because if you notice earlier, I was talking about the fact that if we eat too much and don't exercise enough, we do tend to accumulate extra weight in different parts of the body, sometimes the arms, sometimes the back, sometimes the legs. But that abdominal weight that we carry, and when it becomes excess, that is the most inflammatory type of weight in our body. And if that's where the excess weight is, then that fat will become so detrimental and it'll affect your body such a way that it'll actually get to the heart too. And it can be very, very harmful for heart health and the health of your arteries and everything else that's running around the rest of your body and your cardiovascular system. So you're on the right track. I love where you're going with this. And I really encourage you to talk to your primary care physician. And, doing an EKG is simple. It takes about 5 minutes, maybe 10. I think it's a great place to start, and it's a great icebreaker to open that conversation and get you back on track with your health. I hope you do well, Patrick, and thank you for sending in your question. All right, let's move into the next one. This one comes to us from Zora, and Zora has reached out from Instagram asking, greetings, Dr. Kaur. I told my sister, a nurse practitioner, that I've lost a little weight recently and always seem to be thirsty. She thinks I might be diabetic. What are your thoughts? Hi, Zora. Thank you for sending in your question. Now, without actual accurate testing, of course, I can't diagnose what's going on with you, but she is certainly right to be concerned because those are two of the most common symptoms that we see in undiagnosed diabetics and uncontrolled diabetics. There's a lot of other symptoms too. Let's go through some of them. For instance, chronic yeast infections. This is seen in a lot of uncontrolled diabetics. Blurred vision is also something that's seen in uncontrolled diabetes, as well as sexual dysfunction, nausea or constipation, cuts that are slow to heal because the autoimmune system is compromised, even mood changes. Yes, it can also affect your mental health. Unexplained weight loss, just like you mentioned. Dark patches of skin can also appear in uncontrolled diabetics. excess facial hair or acne, and sometimes this has to do with the hormonal changes that'll happen when your sugars are too high for too long. Skin tags, a lot of skin diseases are associated with diabetes as well. Tingling in hands and feet, and this happens because that excess glucose, excess sugar that's running around in the bloodstream affects the nerves, causes inflammation, a whole bunch of other things, but it causes inflammation, and then that results in tingling and sometimes even numbness in our hands and feet. And then itchy skin. As I mentioned with the other ones, the skin is also very commonly affected when you have uncontrolled diabetes. So it's very, very important that when you have symptoms, honestly, when you have any symptom that's out of the norm for you and is persistent, you want to get that checked out. You want to talk to your doctor and say, hey, this is what's been going on. What is this a sign of? Now, you also mentioned thirst. Thirst is a big, one of the big three when it comes to diabetes. The big three are being excessively thirsty, where your thirst just doesn't get quenched no matter how much you eat, or sorry, drink. And then also on the same token, eating. Also, going to the bathroom a lot is another sign of diabetes sometimes. Now, I feel like we've talked about a lot. I hope you guys have had some good information. Thank you so much for joining us. I'll see you here next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,